Hi everybody, I'm Celeste Chandler and this is the I Am Vets Community News Podcast. First of all, thank you for tuning in today, and I would like for you to like, subscribe, and comment on the show today. Share please so that we can grow the community and get the word out. Today we have NORMA VALENTIN, and we're going to talk about mental health for veterans and PTSD. How are you doing, Norma?
I'm doing good. How are you?
I'm great. It's great to be here.
Yes. Thank you for having me.
You're welcome. So why don't you tell us a little bit about your credentials?
Yeah, so I am a licensed clinical mental health counselor here in the state of North Carolina. So essentially I do therapy, mental health therapy here.
Okay. All right. Well, first I'm going to ask, what exactly is post-traumatic stress disorder known as PTSD?
So post-traumatic stress disorder is a mental health illness that occurs with individuals who experience a traumatic event in their lives. Okay. It can also be something that someone develops from like vicarious trauma. So the trauma may not necessarily have happened to them, but it can just be something that has occurred around them or in their lifetime or something like that, that still presents a traumatic response.
So what kind of responses are those?
Yeah, so some of the symptoms of PTSD would be, of course, there's going to have to be some kind of traumatic event that takes place.
Right.
From there, an individual is going to experience, they can have like flashbacks, nightmares, things of that nature. They also are going to experience a lot of times just changing their mood. So individual you may see may have like a lower mood that may be correlates with like depression or a lot of anger, things like that. So their mood changes. So, one of the more significant things that typically happens with the individual who experiences PTSD is they're going to have a reoccurrence response to the event. So they're going to avoid things that kind of trigger that memory or that experience. They may avoid the space, the time. So anniversaries of different things can trigger responses. So a lot of different things are going to occur when it comes to, again, their mood, having a reaction to the experience over and over again, nightmares, just traumatic responses.
Okay. So we covered kind of some of what the symptoms of PTSD are. Could you tell us about levels in PTSD?
So there's not necessarily levels of PTSD, but there definitely is going to be, to some degree, some kind of trajectory of time that happens. So there's definitely different stress disorders that an individual experiences. PTSD is more of a more significant stress disorder because it lasts longer. And so the symptoms that someone is experiencing from PTSD are going to occur at least for a month. And then that time frame can go up to years, depending on what kind of treatment or help they get. So when it comes to PTSD specifically, there isn't a level within PTSD, but the stressor and the mental health illness can kind of evolve into from like a stress disorder to PTSD.
Okay. So what are some of the issues that veterans face who are suffering from PTSD?
So a lot of times for veterans, their experience with PTSD most of the time is going to be related to the things that they've endured while they have served in the military.
Right.
And so that's going to occur from like an individual who may go into a deployment, and so the things that they experience or witness within that deployment. But also there's a lot of veterans who experience PTSD that doesn't necessarily have to be correlated to a deployment. And so just the experience of being in the military can be a stressful experience.
Right.
There's a lot of things that they endure just by being a veteran. And so PTSD doesn't, I think a lot of people think that PTSD is just for the veterans that have gone to war. But that is not the case. A lot of veterans come home or get out of the military and still experience a lot of stressors or reactiveness to their experience. So specifically with veterans, there is a difference with their PTSD in the fact that it is going to be, if it is related to their military experience, it's going to be specific to what an individual endures in the military. And so those of us who maybe have not served in the military are not going to have some of those same kind of nightmares or triggers or things like that.
Right.
Another thing for veterans is that there is a stigma within the military of being able to kind of like hold things in, be strong, be tough.
Right, it is. It really is.
Yeah, so they a lot of times don't get the help that they need within the military community, and so they oftentimes don't seek or feel comfortable seeking help. And so a lot of times they feel isolated, they feel like people don't understand, they don't get it, and it's just different for them.
Right.
And so for veterans, they are going to, a lot of times they're going to feel isolated and disconnect and dissociate from the community. And that in turn makes the PTSD and their symptoms a lot of times worse.
Okay, so you say there's a lot of separatism. They separate themselves from people. So what are some of the things that we can do to help? And what are some things that they can do to help their symptoms be alleviated or minimized?
So I think for loved ones or just the community in general, I think an awareness is number one. I think the other thing is support. And so just being supportive, just being available, letting the veterans know, whether that's a family member or whether there's community resources that are available, to just say like, we are here to help you. Whatever you need, whatever you want from me, I'm willing to figure out how to do that or give that
Support.
to you.
Yeah,
So definitely support is going to be number one. I think the other thing is there should be an encouragement to seek help, and that it's not a weakness to seek help. It doesn't make you less of a veteran or less of a strong person. It actually oftentimes the courage to seek help makes you a stronger person.
Yes, indeed.
So I think that would be one thing as far as like support. I think the other thing is for veterans themselves, finding ways to reconnect with their community, especially individuals who come home from a deployment or something like that. That isolation of feeling like, things are different. I don't really know this community anymore. So many things have changed, whether it's with the community or with my family or whatever the case may be. So finding ways to reconnect yourself to the community, getting involved in different resources within the community, but also just taking care of yourself as an individual. So whether that's exercising, starting new hobbies, finding a purpose. I think a lot of times the veterans come home and they don't have a purpose, especially once they retire or they get out of the military, their purpose is lost. Like, I knew who I was in the military, and now that I'm not a Marine or I'm not in the Army or not in the Navy anymore, like, who am I or what am I? Or what am I? What's important about me? So finding purpose again, I think is really important.
Right. So you spoke about family. What should loved ones do to help our veterans who are suffering from this?
So definitely providing that support, encourage them to seek help, to seek support, encourage resources. So get involved with your family members as well. If there's something that they're interested in, do it with them. Find the joy in that with them so that they don't feel that isolation. I think the other thing is just also being understanding that, maybe they are going to be a little bit more angry or a little bit more irritable, a little bit more touchy about things. So communicating, if I see that something is bothering you, like, do you need space? Do you need time? What can I do? Do I need to just back away and like give you a moment, whatever the case may be, but not taking things personal? Because I think that can affect the relationships a lot. If I'm coming home and I'm dealing with a lot, especially if I'm trying to deal with it by myself. And then you're mad because you think that I'm being mean to you, or you think that I don't want to be around you or something like that. It's going to make it worse. So being understanding of like this, it's not about you. It's not personal. And if it does bother you, then communicate with your loved one and share with them what's happening so that you guys can get on the same page.
Okay. All right, so we talked about how PTSD affects relationships, but what about COVID-19? How does that affect people who are suffering from PTSD, specifically veterans?
So I think for the mental health community in general, we have noticed that COVID-19 has definitely affected individuals across the board when it comes to their mental health. And the biggest piece is the isolation, I think. We went into a pandemic where everyone was scared to just be close to somebody to breathe on them, right? And so a lot of people, not only am I isolating because of my mental health disorder, but I'm also now isolating because I don't have a choice. And I'm trying to keep myself safe. And so that then pulls people away, pulls you from that community, that support that you may have tried to start or didn't have, and now you can't do it anyway. So I think COVID-19 has definitely played a part in just making the isolation even more permanent. And then also creating a lot of fear. And so with PTSD, these reoccurrences of the traumatic event that you're experiencing is fear-based. In a lot of ways. And so now we're adding another fear on top of what you're already experiencing.
Wow.
And so it can be overwhelming and definitely can just feel daunting. So I'm trying to get out of this dark space with my mental health, and now I have this looming dark space. I don't know when it's going to end, when I'm going to have a chance to see my parents again, or see my kids again, or see my friends again, because I don't want to get them sick or them to get me sick. And so it just has been more daunting for a lot of people, and just has solidified that space of like, I'm alone.
Right, so that really exasperates. COVID-19 has
Definitely.
exasperated the problem that people have with PTSD. Okay, well, thank you. Thank you so much for being here and sharing this information. And can you tell us some of the resources out there to help?
Sure. So there's definitely a national hotline that someone can call or even text now. So the number is 988. And so you can call this number 24/7. It's going to direct you to an individual who is a licensed clinician as well to be able to get you the support you need. But with this, it recently was like an 800 number. Them changing it to this 988 now allows you to text as well. And so while it's not a kind of like a substitute for like seeking help, getting therapy, getting treatment, or things like that, you're not going to want to call this hotline every week for a session or things like that. Although if you need them, every week, I don't want to, I'm not saying like don't reach out for help, but it's not a substitute for ongoing treatment, but it definitely is available, and through them they would also be able to help you reach local resources within your community and things like that. I think the other thing about resources is if they have health insurance, contacting your health insurance and asking for resources in the community as far as like mental health therapy and things of that nature. And then quick Google searches about your community will link you to different organizations or things like that around you that you may be interested in getting support or resources through as well.
Okay, all right. Well, again, I want to thank you, Norma Valentin, for being here with us. And to my audience, I really want to say that if you're enjoying the show and the podcast, please like, subscribe, and comment as well. Thank you for being here to the International Association of Minority Vets News Podcast. Thank you.